Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How does Nexavar work? Is it a chemo drug? Nexavar is an oral cancer drug that is thought to work by blocking certain proteins inside and on the surface of the cancer cell. It also helps to prevent the growth of new blood vessels that help to feed the tumor's growth. This may help kill the cancer cell and keep it from growing and spreading. Nexavar, sorafenib, is used in adults to treat a type of liver cancer, hepatocellular carcinoma or HCC, that cannot be removed with surgery. A type of thyroid cancer called differentiated thyroid carcinoma, DTC, a type of kidney cancer, renal cell carcinoma or RCC. It is classified as a vascular endothelial growth factor, VEGF, inhibitor and tyrosine kinase inhibitor, multikinase inhibitor. Nexavar was first approved by the FDA in 2005 and is manufactured by Bayer Healthcare. A generic product for Nexavar is now available, which may make this medicine more affordable. Is Nexavar a chemotherapy drug? Nexavar, sorafenib, is not a traditional chemotherapy drug, but it is used to treat cancer. It is considered a targeted drug therapy and is given by mouth as an oral tablet. Targeted drug therapies find and attack specific types of cancer cells. This may cause less damage to healthy cells, but serious side effects may still occur with targeted drug therapies. Chemotherapy works by killing rapidly growing cancer cells, but also can affect normal cells without cancer growth. Both types of treatments can be associated with serious and life-threatening side effects. Ask your healthcare team about the side effects you may expect with Nexavar treatment. Nexavar is classified as a tyrosine kinase inhibitor, TKI, and VEGF inhibitor, angiogenesis inhibitor. It is approved by the FDA to treat liver cancer, thyroid cancer and kidney cancer. Does Nexavar cause hair loss? Like many drugs used to treat cancer, Nexavar has been reported to cause patchy hair loss, alopecia, or hair thinning in 14% to 67% of patients. Hair loss or hair thinning is one of the more common side effects with Nexavar. The highest rates of alopecia have occurred in thyroid cancer studies. In liver cancer studies, hair loss, alopecia, was reported in 14%, or 14 out of every 100 patients, compared to 2% of patients taking a placebo pill, with no active ingredient. In kidney cancer studies, hair loss occurred in 27% of patients, compared to 3% of patients taking a placebo pill. In thyroid cancer studies, hair loss was reported in 67% of patients versus 8% taking a placebo pill. Alopecia, or hair thinning or loss, is a side effect that can occur with many different cancer treatments but is usually reversible when treatment stops. Some people may not have significant hair loss, while for others it may be more noticeable. Sometimes hair may grow back a different texture, more curly, or slightly changed color. Hair loss can be a distressing side effect for many patients, but there are ways to minimize this. If you have long hair and find your hair loss is bothersome, clogging up your drains, or causing social or work issues, consider a shorter hairstyle. You might consider a shorter hairstyle before treatment even starts. You might also want to consider using a scarf, hat or wig if you find that your hair loss is noticeable and you'd like to try one of these options. Today's wigs are much more acceptable and realistic looking. Your insurance may help pay for a wig while you have temporary hair loss. Speak to your treatment coordinator about this option. Related, common side effects and warnings with Nexavar. In more detail, always consult with your doctor and cancer care team about any medication side effects during your cancer treatment. This is not all the information you need to know about Nexavar, sorafenib, for safe and effective use and does not take the place of your doctor's directions. Review their full product information and discuss this information and any questions you have with your doctor or other healthcare provider. Related questions: how effective is Nexavar? Does it shrink tumors? Is Nexavar cost covered by Medicare? Lenvatinib versus sorafenib, for first-line treatment in HCC? rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.